Today we are going to be explaining vocal exploration, but before we do that, we watched a video and answered some questions. So our first question was, what does an authentic voice mean to you? And we said an authentic voice means speaking in a way that you are comfortable with minimal to no effort. So that just means kind of just speaking like how I'm speaking right now. I'm not really trying to change my voice. It just comes out naturally. An inauthentic voice could sound more strained and forced and may not be exactly how the individual would like to sound. They are very conscious of their voice as they may be still working on their preferred voice. Then, authenticity and identity are related because your authentic self is usually shown through your identity, so they should match with each other. And I would describe my authentic voice as my everyday voice that takes no effort or conscious thought, so just how I'm talking right now, I'm fine with how it sounds and I'm not trying to change it. We watched a video with Alex, and in this video he discussed how changing the sound of his voice really helped him to feel more like himself and help with him feel like his age. So we realized how important our field is for these LGBT individuals and helping them to feel like their authentic self and who they are meant to be. So to do this, there's different parts. So part one, it would be some stretches from the LMRVT, just to prepare the body to produce these sounds in new ways. So these stretches could be the open heart stretch, a forward stretch, a throat stretch, or a yawn. We would also want to include appropriate vocal hygiene recommendations. So if they smoke, for example, we want to explain to them that that may not be the best thing for their voice. We could also improve the posture as necessary.
So then part two would be educating them about their speaking system. So that would just be improving their knowledge about how to change their voice safely. And then them discussing how they want their voice to sound would be, it would give them a better ability for them to set goals with you, and that usually takes about 1 to 2 sessions. And then the third part would be breath support, where you could use flow phonation exercises to feel the airflow and see the airflow. Or you could use accent method to realize that they can control their loudness or softness of their voice. And then part 4 would be changing pitch. So for feminizing strategies, you could use the piano and have them match pitch and just go higher for however high they want their voice to sound. And then if you're going to masculinize the voice, you could teach them how to use PROT to record and track their pitch while they're taking testosterone. And then their confidence will be boosted by seeing the change over time, and it'll help reassure them that their pitch is in the male range. Then part 5 talks about resonance, and so one of the goals for working on resonance is to manipulate your vocal tract. And so a way to make it more masculine is to rub your chest or your rib cage while you're humming to put the sound more in your chest. You could also yawn talk or protrude your lips or use the ah with a megaphone with your hands. So I'm going to show Josie an example, and then Josie's going to do it. So if we're going to do the first one, to rub your chest while you're humming, you would go Good job. Then you would, part 6 would be moving to intonation. And a lot of this is similar to how you would do work with patients with motor speech disorders. And so for this exercise, you could vary your pitch while you're humming or prolonging vowels or counting. So I'm going to model, and then Josie's going to show you. Good job, Josie.